For thousands of years, practitioners of traditional Chinese medicine used the yuan zhen, or round needle, to clear meridians without piercing the patient's skin. Today, we have a modernized version of that instrument, the magnetic acupuncture hammer, which utilizes a specific dual-headed design. This device connects those ancient clinical meridian practices directly to modern biophysics. In this exact sequence, we are going to break down the science of how magnetic therapy interacts with the body and walk through 3 specific application techniques. By mastering this specific tool, you will gain a highly precise, repeatable framework for non-invasive, deep tissue cellular healing. This diagram illustrates the body's meridian network. To understand how the hammer works, we must recognize that these pathways function as a literal direct current, or DC, electrical system. Specifically, this biological circuit carries a constant low-level flow of approximately 10 microamperes. This tissue model demonstrates Faraday's law. When an external magnetic field intersects an active biological circuit, a very specific reaction occurs. As the moving magnetic waves from the hammer penetrate the tissue and strike the DC line, they trigger localized electromagnetic induction. Because of this induction, the tissue does not passively receive mechanical pressure. It is forced to generate its own restorative electrical charge from within. By using induction to generate these charges, the practitioner replicates the ancient goal of clearing stagnation, restoring the electrical flow the body uses for its own repair. Before applying the hammer, safety verification is a mandatory first step. This chart outlines strict safety parameters. Never use magnetic therapy on individuals with pacemakers, metal implants, or insulin pumps. Avoid application during pregnancy or over broken skin. Contrast those absolute barriers with normal, expected reactions, like mild mechanical redness on tapped areas. Patients may also experience transient fatigue or lightheadedness. These are indicators of successful, deep shifts in the autonomic nervous system, not injuries. Looking at this biomechanical diagram, the angle of application entirely dictates your clinical bioeffect. We have 3 primary modalities. Step 1 is percussion. Use the multi-pronged plum blossom head. Hold the handle exactly 1/3 of its length, securing your grip with 3 fingers. Deliver a gentle, rhythmic bouncing tap, keeping your strike at a strict 90-degree perpendicular angle to the skin. This perpendicular strike creates sensory activation and lightness, which relieves general meridian blockages. Technique 2 is rubbing. Flip the tool to utilize the smooth, round magnetic head. Before you begin, you must apply a high-quality massage oil to the patient's skin to ensure a seamless glide and prevent painful friction. Adjust your grip to the base of the handle. Lay your index finger along the shaft for support. Tilt the hammer to a 45-degree angle. Apply continuous, steady downward pressure while gliding across the oiled skin. This angled glide mechanically flushes the local circulation, generating deep tissue warmth and softening tight superficial fascia. Our final technique is acupressure. Use the round magnetic head or the handle's end for smaller points. Return the tool to a strict 90-degree angle, positioned directly over the energy point. Apply static downward pressure, combined with extremely small, microcircular massaging movements. Holding the magnet steady in this way delivers deep, focused electromagnetic induction, making it ideal for treating chronic trigger points and localized joint pain. This chart breaks down our baseline clinical protocol for structuring a full treatment session. For new patients, begin with 15-minute sessions, 2 to 3 times a week. You will adjust this frequency based on the patient's physiological response. You now have the precise clinical framework to properly integrate the magnetic hammer into your practice. This table summarizes the 3 application modalities: the 90-degree percussion tap for activation, the 45-degree rubbing glide for tissue warming, and the deep static acupressure press for targeted relief. With these 3 techniques, you have a specific capability: the ability to safely manipulate biological electrical currents to resolve systemic blockages, all without invasive needles. By mastering these protocols, you have successfully bridged the ancient wisdom of the 9 needles with the proven science of modern electromagnetic healing.